What is abreaction? An abreaction is an emotional, unconscious reaction that you have to respond to something that brings back painful situation you experienced. In your past, you must have experienced a lot of painful situations, very traumatic situations. Those situations, if it comes suddenly, that is called abreaction. It's an emotional, unconscious reaction. It may be an event that you remember, or it may be something that suddenly pops into your consciousness when having an abreaction. According to American Psychological Association, the therapeutic process of bringing forgotten or inhibited material, forgotten, that means you have forgotten those material, or inhibited, which has been inhibited within your brain, from the unconscious into consciousness, with concurrent emotional release and discharge of tension and anxiety. If you bring this traumatic event, which were actually hidden in your brain, it could mean that your anxiety and tension could be released. This therapeutic procedure is called abreaction therapy. As an example, consider someone who has been physically abused, who responds to a raised hand by cringing even though the other person intent was to brush away the stray thread. If the person is raising a head towards a physically abused person, that person may suddenly catch this hand or push away this hand, mainly because the abused person believes that this is a reaction. This has been brought to hit him or to trouble him or to harass him. Abreaction can also be used to describe the process a therapist uses to desensitize or help you to stop having these automatic reactions. Once the reaction comes, the affected person may be having a lot of anxiety or stress, all those things, sudden emotional outburst. Sometimes during a therapy, this can be used to bring out all the emotions which are actually hiding inside you. Nowadays, this therapy is not used alone, it is used in connection with other therapies. Within the safety of a therapy session, you may be led to experience abreaction so that you can then learn to replace the illogical gut instinct reaction with one that is more suited to the situation. History of abreaction in therapy. Abreaction, along with its counterpart catharsis. You should know what is catharsis. If catharsis you don't know, I will be covering it in the next lecture. Which refers to emotional release, was first discussed at length by Sigmund Freud. In a way, catharsis also is a process with which the emotions are being relieved from this person's mind. Abreaction was first discussed at length by Sigmund Freud and Joseph Breuer in their early studies on psychoanalysis. They initially put a significant amount of emphasis on the importance of abreaction and catharsis in psychoanalysis. This theory was actually made during the psychoanalysis theory. After more study, Freud and Breuer realized that simply expressing or relieving painful emotions is not all that is needed to achieve recovery, particularly for trauma survivors. They realized that it alone will not suffice. The emphasis on achieving catharsis through abreaction carried on through World Wars I and II through trauma therapists who used hypnosis and chemically induced techniques to create abreactions. Some therapists did realize the importance of helping trauma survivors do more than just deal with their emotions. However, uses of abreaction. Abreaction is rarely used in isolation as a therapeutic tool. It is rarely used. Simply eliciting a reaction to stimulus does something or nothing to address the emotions and behaviors associated with the post-trauma. The value of abreaction is that it can lead to realization. However, that does not mean that the feelings surrounding the difficult experiences have been resolved. He will feel the problem, he will feel the trauma associated, he will feel the emotions associated, but that doesn't mean that the experience have been resolved. While abreaction has been largely disregarded for therapeutic use, some therapists may use it in some context, usually integrated with a larger treatment plan. When abreaction occurs, people may work with their therapist to deal with the feelings associated with past trauma. This is where CBT comes into action. The past trauma will be experienced by that person, and the therapist will help him bring down all those difficult emotions. After bringing a past trauma to the mind, memories can be carefully explored with the support that the person needs to cope with the trauma. Learning to integrate these experiences and lean on valuable coping skills may minimize the dissociation that people can experience to respond to trauma. Trauma has dissociation. You will feel that they are dissociated from the present. That can also be removed. For example, some research suggests that a technique known as abreactive ego state therapy may be effective for treating post-traumatic stress disorder. This process involves the use of repeated hypnotically induced abreactions of the trauma followed by ego strengthening. This therapy is called abreactive ego state therapy. As an integrative approach, abreaction may have some value when incorporated into a treatment plan that utilizes other treatments such as cognitive behavioral therapy. Abreaction may also occur during a treatment known as eye movement desensitization and reprocessing therapy, EMDR therapy. This approach is sometimes used as a treatment for PTSD, post-traumatic stress disorder, anxiety and other mental health conditions. During this treatment, people recall difficult or traumatic memories while engaging in bilateral eye movements. Abreaction is no longer used on its own as a treatment, but it may come into play in other types of trauma therapy. Understanding the reaction, identifying the thoughts and emotions behind it, and replacing those thoughts and reactions with more effective ones can be helpful. Impact of abreaction. Freud's initial belief in promoting abreaction in therapy was that though the release of painful emotions, the traumatic experience would be less distressing. Today, experts recognize that repeatedly experiencing traumatic memories and emotion does not relieve distress. Trauma often causes people to dissociate from their emotions, memories, and identity. The amount of dissociation a person experiences can range from mild, similar to daydreaming, to severe, as in the case of the people with dissociative identity disorder. Some schools of thought believe dissociation needs to be dealt with by making it part of your consciousness and identity. Here, schools of thought means psychology has different schools of thought like psychoanalytic theory, behavioral theory. While dealing with dissociation is important, mental health professionals understand that dealing with traumatic stress, such as that associated with PTSD, cannot rely just on treating the traumatic memories with abreaction. In fact, studies have shown that one of the best kinds of therapies in PTSD is cognitive behavioral therapy, that is CBT, which has nothing to do with abreaction. Cognitive behavioral therapy for trauma. CBT works because it helps PTSD survivors reframe their thinking about their trauma. For instance, a rape survivor may feel illogical and unnecessary guilt for the situation they were in while they being raped. With CBT, the person would learn to change their thinking to realize that it doesn't matter what situation they were in, only rapist rape, and they could then learn to let go the guilt. Changing faulty thinking and replacing it with moral, rational, and more factual thinking helps PTSD survivors cope better with the feelings of guilt, anger, distress, and fear they may have. Tips for coping with abreaction. If the abreaction comes suddenly, the emotions come flooding, what we can do? While some abreaction may take place as planned component of therapy, spontaneous abreaction can occur at random times when you least expect them, especially for the trauma survivors. Stimuli that mimic past trauma might unexpectedly trigger a reaction as you go about your daily life. Experiencing abreaction can be intense and upsetting, but there are strategies that you can use to go. For example of sudden abreaction, for a person who has been into an earthquake, a sudden change in weather, a sudden change in the weather condition, a sudden blow of a horn, all those can be all those can bring sudden emotional outburst. Be aware of triggers. The first tip for coping with abreaction is being aware of the potential triggers may help the person more effectively deal with abreaction when it happens. While trying to avoid triggers is understandable, this type of avoidance coping can make anxiety and reaction worse in long run. Instead, focus on looking for strategies that will help you manage those responses. Tips for coping with abreaction, that is continued here. The second one is practice calming techniques. Abreaction can put your body in a state of alert. So finding ways to calm and relax your body is essential. Deep breathing is one strategy that can particularly effective for soothing distress and anxiety. Third point is find support. Having supportive people around you to talk can be helpful when you are coping with difficult, traumatic or intense memories. Try talking to a trusted friend about what you are actually experiencing. The fourth tip is to talk to a therapist. If you are experiencing abreaction, consider talking to a mental health professional. They can recommend treatments that may help you process and cope with the trauma, such as CBT, EMDR, or other types of therapies. Summary. As a summary here, abreaction is an unconscious reaction to a stimulus that triggers the memory of a painful experience. While once used as a standalone treatment, therapists no longer rely on this strategy alone when treating trauma. Instead, mental health professionals may explore abreaction as a useful way to inform other types of trauma therapy. People experiencing spontaneous, unguided abreactions might find it helpful to utilize coping strategies and seek support from trauma-informed therapists.